Okay, so welcome everyone. Um, this is Michelle, who was very kindly offered to do a webinar on SMA, school and COVID-19. Very excited that this is our first webinar for our SMA Awareness Month, which I know doesn't start until tomorrow, but we just had too many speakers, so we had to do it a day early, which is just amazing. But I'm going to hand over to Michelle now to start. Remember, any questions, put them in the comments below, and we'll answer them all at the end.
Great, thank you, Marnie. Just wanted to say good evening, and thank you very much for those of you that have taken the time out to come and listen. Also, just a little introduction to myself so that you know where I'm coming from. So I am a primary school teacher. I have been for 20 years, have been a Senko now for 6 years, and for the last 3 years have been working in a primary school in Kent, which has a specialist resource provision, or which we call an SRP, for children with physical disabilities and complex medical needs. This has been such a steep learning curve for me, not just the last 3 years, but just being a Senko for the last 6 years. But I have thoroughly enjoyed learning about and supporting all the different children and all of their different needs. Not saying that I have it all right, it's a continual learning curve and something that I'm very aware of, that we are always trying to improve on. Also like to take a little time to explain how an SRP varies to a mainstream school. We currently have 6 children within the whole school, which is one form entry, incidentally, 6 children that are part of the SRP. They are throughout the school, all in different year groups, but are still an integral part of their class. So they do everything that their classmates do, with a few extra things thrown in. So for instance, they will obviously have time to have their physio, they will have their hydrotherapy, they have specialist trike lessons that we run during the warmer months, and we also run a bocce club for our SRP children as well. I think the big difference between a school with an SRP and perhaps a mainstream school, just a mainstream school, because obviously we are mainstream but we have an SRP, is in the funding. And I think that's a really key point to explain today, because our funding for our SRP children is guaranteed. Schools that don't have that are having to apply for funding to support children in a very different way. It's a very laborious task. It's difficult to try and make sure that you have included every part of support that that child needs within the forms that need doing. And also not all councils will give 100% of that claim, because there just isn't the money. So schools are having to pick up the shortfall there. That's something that's really important, because not every school is funded in the same way. And not everything that we offer, perhaps a school down the road could offer, due to that fact. I also wanted to explain that although we have 6 children in our SRP across the school, only one of those children currently has SMA type 2, and obviously the needs of individual children, even within SMA, are so vast and have to be taken into account. So that's just a little bit of background into where I come from and the school that I'm at as well. Also just wanted to talk a little bit about pre-COVID, if you can think back that far. It seems that COVID has been around forever, it's really taken over our lives. But pre-COVID, actually, together, I think, with the help of our parents, we were almost heading towards the way that we are going to be working in September, due to, worries about infection, etc. So I'll just run through some of the things that we had in place before COVID reared its very ugly head. So I think what's really important is that we had an understanding across the school about what SMA is and the impact of SMA on children's lives and families' lives, in fact, because I think that's key as well. It's very well for the class teacher and any support staff to have an understanding of SMA, and that is vitally important, obviously, and the SENCO. But equally, you know, there's other staff across the school that need to know. The leadership team need to know why they're having so many days off. The admin team, the school office need to know why your child is coming in late, because either they haven't slept very well that night, or they've had to have extra physio that morning, so they're coming in late because that has had to take place before they're ready to learn. And it's key that that understanding is across the school so that everyone knows. Also, there has to be an awful lot of staff training in place. So we have staff training regularly for moving and handling. That's to make sure the safety of not just the children, but also of the adults that are doing the moving and handling. And together with that comes risk assessment writing to make sure that the children are safe every step of the way as well. And of course, we also have regular cough assist training. With the cough assist, I have been forever wowed by the staff that come and do that training, the specialist staff that come and do that training from their, the various hospitals that they work at. They will often come in and are so supportive of staff, of the children. They want to get it right so that the children can come into school and learn. And if we have new staff, they will come and train. If we have the same staff, then that is not necessarily every year unless the plan changes. If the plan changes and they have an understanding of the plan, then perhaps there could be some extra training, but otherwise it's generally when we have new staff come in. Obviously, we also take relevant advice from specialists. I've talked about specialist paediatric specialists, physios, etc. But we also have the regular school NHS physiotherapists and OTs that come into school. They advise on seating, on again on moving and handling, on their physio programs, on any fine motor that they are able to access, etc., etc. And they are key in further developing the children. Now, obviously, where I work, I'm really lucky because the physios and OTs that come in are coming in for the vast majority, those 6 children. And so we have a really good, positive relationship with that team. And again, if I call them, I know that they will be there if I need them. Not every school has that, unfortunately. You can build a positive relationship, but you don't always have as good a relationship because you don't see them as often. And so that is not necessarily going to be the same. But again, I can't thank the physio and OT team enough for everything that they do to support school staff. They are thoroughly amazing. Another thing that we have, before COVID, always thought about is not just staff health, but also the health of other children in the class. So I think some of these questions might even be cropping up later, so hopefully I'm answering some of the questions. In terms of children's health, the practice at my school is that if a child is unwell, the parent rings the school in the morning to inform the school that they are unwell, that they will be absent, and what the problem is. If it's felt that illness will have an impact on certain children with medical needs, then that is passed on to myself or my assistant, and then we contact parents to let them know of this so that they are aware. Equally, the school secretary is amazing. She knows where siblings are and she will know where that will cross over to siblings of both the child with SMA and other children, and also siblings that are in this child's class, if that makes sense. I hope you're following that. So we will alert parents if there's a vomiting or sickness diarrhea bug, or if there's some kind of respiratory infection going on as well. Staff health is equally important. We can't stop staff coming into school if they've got a cold. In fact, and I'm talking pre-COVID here, by the way, in fact, obviously, if every time we had a cold we didn't come into school, then we would be short-staffed a lot of the time. So we really have to think carefully about how that's managed within the key classrooms. If it's the class teacher, currently what we're doing is that the class teacher continues to teach that class, but at a distance of the child that is at risk. And obviously increasing hygiene within that class, so increasing cleaning surfaces, increasing the teacher washing hands, and always following the catch it, bin it a message that comes from the government. Sorry, lost my words there, it's Friday evening. If, however, it's support staff that are working directly with a child at risk, we take a slightly different tack as a school. And this is something that we've thought long and hard about, and something that we have chosen to do with the support of parents. So what we do is that we will do a swap within the school to a healthy member of staff to then reduce the risk of infection to the child. Obviously that works okay when there are a few people that are infected, but if there was a number of people with a cold, that could be a problem, that could pose a problem, in which case I would be contacting the parents to let them know and let them decide what's best to do. Another thing pre-COVID that we would always do to support is that we would always do a temperature check in the morning to make sure that the room is warm enough for the child coming in, because we really don't want to pose a risk for any infection to breed within the classroom. If it's not warm enough, we put some heaters in the room to try and get it up to temperature before the children come into school. If that still hasn't quite got to the right temperature, we use a different room with the school where the support member of staff will come and do some one-to-one, some teaching, to make sure that they're not missing out on learning time. Obviously they're not with their peers, but we can't remove other children from their classroom, and it should only be a short time until that room temperature gets back up, and they can return to the class and be with their peers. Another thing that I'm sure lots of you have come across is a key handover in the mornings when you're dropping your child off at school, is that you're able to have a conversation. Are they able to go outside? How tired they are, how they've slept, what their respiratory function is like for that day. And so hopefully you have an opportunity to do that with key members of staff. As I said, we were already doing a lot of things pre-COVID that perhaps we're doing more so now. So things like children at risk would have their own hand gel to make sure that their hands were sanitised. Their equipment would be regularly cleaned, and often they would have their own set of equipment that they would use to stop cross-contamination. Another key point, and a really tricky one with any children with physical disabilities, is care needs versus learning. It's a really tricky one for any school, because obviously children do need their care needs met. They might need to use a care suite to use the toilet. They have physio, they have other programs that they need to do, and which part of learning do they miss out on? Where possible and where the child is comfortable, because it's really got to be right for the child, we will try and do physio, etc. in the classroom, so that they're still in the hubbub of the classroom, so they're still listening to their teachers and to other peers. if the child doesn't like that, that could well be the case, that they feel that everyone's looking at them, you know, every child is different, then that will happen outside of the classroom. And if obviously care needs need to be in the care suite, so where possible we will take learning out with them. So that's things like in the care suite we have had phonics posters and freezes around the care suite so that they're always going through their phonics. We can play times table games as we're doing different things. And also it's about perhaps finding other times in the day where you can pre-teach a child for something that's going to be coming up the next day. And that's really powerful for children with disabilities or children that are off and off school, because they are fully prepared and already they're ahead of the game of their peers and they're not feeling like they don't know. And I think that's a really key point for some children, to have that ability to have pre-teaching perhaps the day before. Doesn't take long, about 5 or 10 minutes, because it's one-to-one and they're just that much more prepared for what's to come the next day. So that's something that we found really useful. In terms of since COVID, to be honest, we haven't really had all of our SRP children return back to school yet. We were trying our best to invite as many children as possible, but understandably it wasn't right for certain children to come back yet. Every school should be doing a risk assessment, a whole school risk assessment, to show what they have put into place to reduce risk to others. Now, I am sure that if a parent were to ask for a copy of the risk assessment, then that would be made available to parents who are concerned. I don't see why that would not be shared, but that's something that you could ask your own schools about. Perhaps if there is a whole school risk assessment, what does that look like? And that might make you feel better about your child accessing school. Schools also, from the beginning of lockdown, were asked, certainly for certain children, particularly children with educational healthcare plans, to create individual risk assessments. Now, right at the beginning, this was done to make sure, almost to see that children were in fact safe staying at home. Obviously, the guidance then was stay at home as much as you can. There was a concern from the government that with the amount of need that some children have, that could provide burnout to carers, etc., and that perhaps they wouldn't be able to get the same interventions and perhaps physio programs with other children at home, etc., etc., that would be happening if they were accessing school. So an individual risk assessment would have been written back then for each child who has an EHCP. Guidance now states that all children should be coming to school. I completely understand that that must be very scary for many of you, and I think that every school perhaps should still be with children with certain medical conditions who really have a respiratory risk, should be having a risk assessment of their own to support them coming back to school. Obviously, this is best written with professionals and with you as parents, because you know your children best. You know what they need, how they need it, and you know their emotional state as well. They've been with you an awful long time now, and you know how they're feeling, and perhaps they're feeling a little bit worried as well, and that's something else that needs to be brought up. So that's really something that needs to happen perhaps for children with those sorts of conditions. So once again, just want to say that every school is different. So I'll run through some of the things that our school is doing. I've probably missed out a lot of things as well because I was trying to list these down. And where I've lived COVID for the past 4 months, it's just ongoing guidance is continually updating. And we have things set in place for September, but who knows whether we'll be back in September. So we will have to see how things go. So currently, what we're going to have in place for September for our at-risk children, or for all our children really, so we will be doing individual risk assessments for children that need it. We will also be ensuring that all children, not just children that are at risk, but all children have their own set of equipment. The equipment will be kept in a washable container, and the idea is that on a Friday this set of equipment for each child will be cleaned so that it's ready for Monday as well. So the equipment itself won't be cleaned daily, but at the end of the week it will be cleaned, but it's only to be used by one child anyway. There is a stringent cleaning regime in place of desks and surfaces. There are guidelines for the number of children that can use a toilet at any one time. Again, I'm a primary school with one form entry, and that is how we are running it in our school. That doesn't mean it should happen like that, and that doesn't mean that every school is able to run like that either. It's not an easy thing to do. We have had to set up systems within the school to ensure that that is done in as safe way as possible. Equally, when we come back to school in September, we are fortunate as a school, every classroom has an external door. So all the children will be using the external doors to enter their classroom. We won't really be using the corridors at all, although there is still a one-way system within the corridors. Again, not every school is able to do that, so it really does depend on your schools. Obviously, we're having staggered starts and staggered endings, which I believe is guidance for every school. So that is something that you may have information at the moment or may not, as schools are still trying to figure out what they're doing. Within classrooms, the children are being asked to wash their hands regularly throughout the day for at least 20 seconds. Soap is being provided, and children can bring in their own hand gels if they wish. We also have had to provide, which we didn't have previous to COVID, lidded bins, so that any tissues that are used for coughs or sneezes, they are thrown away immediately in a lidded bin, and then children again are asked to wash their hands immediately. Any unwell children, if they become unwell on the day whilst at school, myself or my assistant are called to remove the child. That sounds horrible, I don't mean that in a horrible way at all. Asked to remove the child from the classroom. They are taken to an isolation room where they will stay until they're picked up by their parent. Then we ask the parents to have a COVID test for the child, and then if that COVID test comes back negative, they can come back to school. That's how we're currently running things, because the symptom list is ever growing, and also children don't show the symptoms of COVID in the same way that adults do. Some schools are still doing temperature checks for children. I have heard, I don't know how true this is, I'm not a medical profession, but I've heard that children with COVID don't necessarily show a high temperature, so that's not something that we as a school are choosing to do. But if they are showing other symptoms, any symptoms of being unwell, then we will take them to the isolation room and they will be picked up by parents. Children that are at high risk, that do need intimate care or are having perhaps one-to-one work with an adult. Up to this term, it was advised that if a support a member of staff, a TA for instance, was working with a child one-to-one quite close for longer than 15 minutes, they were at that point wearing some form of PPA. So they were wearing a mask or a face shield and some gloves. The new guidance from government is now that the class is a whole bubble and that should not be needed. However, as a school, we have decided that if there are at-risk children, and certainly definitely for intimate care, which we would do anyway, staff will be wearing PPE for that, and that will be a face shield, gloves and an apron for intimate care. And working one-to-one, it will be a face shield or a mask. I don't tend to like using masks too much in a primary school because I certainly have noticed walking around the shops recently where I have been out, the lack of communication you get from somebody's face being covered up. And so we do have these plastic visors that fully cover the face, which does offer some protection as well. So I think that the children benefit from being able to see adults' faces properly. The schools also, I just wanted to say, also reflecting on how this whole pandemic has really changed things for so many people. Yes, we're expecting all our children to be back in September because that is what we've been told by government. But yes, I'm a mum too. My children don't have any medical conditions that I need to be worried about, but I'm still worried about my children. And for children that are at high risk, I really understand if you would be concerned about bringing your child back to school. I completely understand that. But it's not for me to say whether you should or shouldn't. That's your choice as a parent. But what we are looking at as a school is how we can still include these children in our daily school lives. If anything, these months of school closure has shown us how much children need that contact with their key adults, with their peers. And we are really trying to look at how we can improve in that respect and allow them to access some learning if they have to be from home and some social time from home as well with their peers. And before I go to questions, I did just want to say that I have come across, I'm sure many of you have as well, a mum has started up a charity, I think she's based in Cornwall, called Shield Us, and I've ordered some badges and some t-shirts for some of my key children. It's got the Shield Us logo on it, and it's just a visual reminder to those people that may forget or become a little complacent about how we are moving on post-lockdown, because we're certainly not post-COVID. They are, you can find them on Facebook if you are interested. I know they're doing face masks, they're doing t-shirts, hoodies, badges, all sorts of things which you may be interested in having a look at. I hope I have given as much information as I can. I know there's a number of questions which I may or may not have answered, but let me see if there are any more that have come in. Marnie, are you there?
Yeah, I'm here. Yeah. So shall we start with the questions that we've got? Remember, if anyone else has any questions, put them in the comment section below. So the first question we've got is, are you able to clarify guidelines in relation to risk assessment coupled with reasonable endeavours? Is this obligatory that these must be done by schools?
Okay. As a Kent school, we have been asked to do a risk assessment for the school. So I know that Kent schools have been asked to do that. I would think it's sensible for any school to do a risk assessment on opening, and I think it's a fair question as a parent to ask for a copy of that risk assessment so that you can see what has been put in place to support the children coming back to school. In terms of reasonable endeavours, the schools have to do what they can to make sure that children can access school and coming back to school. It shouldn't be at too much cost of the school, but they have to show that they are doing what they can. That's probably a little bit of a woolly answer for you, perhaps, but I think if you have that perhaps conversation with your school saying, okay, what best endeavours have you used? What have you put in place, and what has been the impact of that? That might be a worthwhile conversation if you're thinking that perhaps they haven't. Does that answer that?
Yeah. Okay, next question is, with current guidelines, are schools able to obstruct access for therapists, e.g. physios or OT, even with therapists suggesting alternatives such as playground visits or wearing PPE whilst on school grounds?
Okay, again, that's a school by school basis question. I understand where it's coming from. Obviously, if your child has an EHCP and written within that legal framework, that legal document is that they need access to physios and OTs, somehow that has to take place. There was a period of time previously where the government released the legal obligations of an EHCP, but certainly come September they are back on unless something happens drastically over the summer. So as you know, as far as I'm aware, that if that is written into the plan itself, then it needs to happen. Every school, as I said before, is different, and they are probably coming across different difficulties and challenges every single day. They should risk assess a visit from a physio or an OT, and somehow perhaps investigate ways that this could happen, because if it's legally within their plan, it kind of should be happening.
Okay, that's good, thank you. We've got a question from a parent who is a TA in a mainstream primary school who has been shielding the daughter who is 21 and type 2 SMA, and are confused as what to do in September, whether or not they should go back to work. Their neuro consultant has been encouraging people to get back to some sort of normality. The government shielders can go back to work from August as long as the workplace is COVID safe. But how can school be COVID safe? I think she's just her mind's in turmoil, and she's just asking if you've got any advice.
I wish. That's a really tricky one. I completely again understand where you're coming from. Government are suggesting that children are not necessarily passing on the disease. It's the adults that are passing on the disease. That's my understanding of what they're saying currently. So as a school, what we are doing, where obviously children are in their bubble, then they can, although we're asking them not to, where they can come closer than the 2 meters. Certainly early years, it's really tricky. I'm not sure what age group this TA works in. But with adults, we are being completely strict about that 2 meter rule for adults. And I know it's 1 meter plus, but we are still standing by our 2 meter. The staff room is out of action because it means people coming together. Playtimes, lunch times are all separate times, and so that the chances of staff actually coming close to one another is low. I would suggest perhaps talking to your senior leadership team at the school and requesting that you are allowed to wear perhaps a visor, as I spoke of earlier, so that you can still see your face, and whether you're allowed to wear things like that. They also suggest things like when you come home from work is that you put all your clothes straight in the washing machine in case you're concerned that you might have picked something up. But I can't really obviously tell you what to do. I understand where you're coming from, but I do know the guidance is certainly that everyone should be returning to work from tomorrow, isn't it? But if I can point you in the direction of the Shield Us Facebook site, where perhaps you can wear a t-shirt to remind people, that actually you've got someone at home who's at risk, please look after me, please keep your distance. It's about trying to not be complacent around in that school area. I'm not sure that's really answered, but that's probably the best that I can do.
Thank you. And we will put the link to the Shielders on our Facebook and in our groups as well. So I will do that after the live. We've got another question. What should I expect with toileting and handling precautions?
I think I've answered that question, actually. So in terms of toileting, obviously the children still need support with their intimate care. And we as a school it's still expecting that adults will wear full PPE to do that. So that involves a mask or a shield, an apron and gloves, which are thrown away at each change or toilet. Yeah, I think that's where we're going. So that's hopefully what every school should be doing. But to be quite honest, when you're doing any kind of toileting, you probably should be wearing some kind of protection anyway. So that should hopefully already be happening in schools. Is that what they were trying to find out, Marnie?
Yeah, I think so. Yeah. I am just going to say we're starting to get thunder and lightning.
Oh no!
So if we may have had a power cut. I have messaged one of the other trustees, so hopefully if that happens, they can jump on. If I disappear, you know why. Our staff working with vulnerable children asked to take the temperature before coming in for the day.
So is that if staff are asked to take temperature? We don't do that. We are asking that if any staff are feeling unwell in any way, then they alert us, and that actually if there are any of the key COVID symptoms, that they remain at home. But we are not taking temperature of staff that are coming in, no.
Okay. Do you ask parents to disclose any information of illness in the family?
So if the parents of our school know that we have children with complex medical needs, and they are usually really good at letting us know that if they have other people within the family that don't attend the school and that there's a risk of COVID, then they will let us know. Any ill health is not necessarily shared unless it's a sibling. But I think it's the nature of our school and the understanding of the children that we have there means that they would let us know if there was any risk of COVID.
Okay, great. So I think this one's kind of been covered, but I'll ask it anyway. COFSIS training, how often is it done? Do you train every new TA? For a while, my son's has not been serviced for a while. How often do you require them to be serviced?
Okay, so COFSIS training that we do at the school is if we have a new member of staff come in, or if the plan changes drastically and we need to change the way that it's administered, then we would have new training for current staff that know about it. The COFSIS machine that we use is brought in by the parent, and so I believe it's in their hands to have it serviced, but I might be put right. I believe it's the hospital that would do that, but I might be wrong there as well. I do apologise if I'm not saying the right thing here. But certainly we don't own a COFSIS machine at the school. If we did own a COFSIS machine, then yes, we would service it in the same way as we do the hoists that we have in school. So all the other equipment we service annually. I would have thought a COFSIS machine would need to be pat tested and things like that. So there would need to be some kind of servicing involved, but who does it reside with would be my question. Is it the schools or is it the child or the parents, if you see what I mean.
I know from my experience, it was my machine that got serviced by the hospital
Yeah.
that I looked in school, but of course that could vary area to area. So you may need to check your area's
Yeah.
rules on that kind of thing. Um, Another question is, there are obstructions in the corridors, which are meaning my child does not have the free range of the school. How can I go about getting this changed?
Okay. Schools have been put in a really tricky situation. They've had to empty classrooms hugely to allow for social distancing within a classroom, and it has been a huge challenge to schools. Our current hall is stacked almost to the roof, to the ceiling, with all sorts of bits that we've had to remove. Corridors, that I don't want to say anything negative about other schools at all, but it would surprise me if corridors were obstructed, because fire routes out of the school have to remain free of any obstructions, and so that surprises me somewhat. I would question, if other children are accessing those corridors, why can't my child? That's best endeavours, again, and that actually the Equality Act, if other children are accessing that area, then my child perhaps should be. What can we do to help that happen, would be my question.
Okay, great. We've got another one asking, how are you inclusive with sports and what facilities do you have?
Okay, with sports, we do our best to make activities around supporting any children with specific needs within that class. So it's very specific to the class. We are like every school. We have a small paved playground area. We have a field which is quite bumpy and quite tricky for wheelchairs to access. We are very lucky as an SRP that we, due to our extra funding, are able to access hydrotherapy for our children with physical disabilities, and they go off to a pool, hydrotherapy pool, to another school, and so can access hydrotherapy. So where their classmates may well be going to another swimming pool, if that's not accessible to them, they do still access the hydrotherapy. So in that way, they're not the same as their peers, they're not accessing the same swimming pool, but equally the same swimming pool would be a colder temperature, it would be harder to get into and come out of, etc., etc. So it's about risk assessing, best endeavours, and actually what's safe for the child. In terms of sports generally, as I said, we try and make the activities as inclusive as possible. We also will try and include some form of physio within a PE session, so that they're not coming out of class too much to have their physio. If it's possible to try and put that into the PE lesson, then that's what we try and do. I forgot, I've lost my train of thought now, goodness me. And yeah, it's just about trying to make the activities suit so that as many people as possible can access that activity. That's what I was going to say. I was going to talk about the boccia. If any of you know about the sport boccia, our children in the SRP do join in a boccia club on a Friday. It's a bit like bowls, but it's quite it's a big sport in Paralympics, so it's a nice sport for them to do.
Okay, great. We've got a few questions on the line as well. How will your school be managing breaks, lunch, and PE?
Yeah, with great difficulty. So we have staggered starts, we have staggered endings. Those currently, our plan for our school is that reception, year 1 and year 2 children will be accessing a lunch in the hall, a class at a time with cleaning in between. The junior classes, years 3, 4, 5 and 6, they will be having their lunch in their classrooms. We're really fortunate. We've got 3 outside areas that are actually separate as a school. Not every school has this. Certainly some inner city schools won't have this luxury at all. And so we're able to let bubbles come out to play, that year group, that class, to come out to play at their own set time, be supported by the adults, and then come back into class. So it's all done very carefully timetabled to make sure that there's no crossover.
Okay, great. Another question is, will schools be provided with PPE for the child's one-to-one toileting and physio times?
Schools are having to buy in their PPE. Certainly my school is having to purchase its own PPE. There was, I think, a point where extra costs were going to be covered by the government. I think that's stopped now. But I believe that any school that is caring, and every school cares for their children and what's the best for their children, they're going to want to make sure that their children are safe, that they're remaining well, and I believe that they will do what they can to ensure that that continues. So I believe that that will continue. Certainly in my school, yes, if they're doing physio or anything close contact, then they will be wearing PPE because it is a risk to them.
Okay, great. We've got another one saying, my dilemma for returning my daughter to school is she has severe scoliosis and her organs, such as lungs, are not at full capacity, which makes her a higher risk. Would you expect them to return like normal children in September? Okay,
that would not be, that would have to be the call of your medical professional, whichever medical professional you have. That's a really tricky one, and I wouldn't ask any Senko or any educationalist to make that call. Obviously, socially and in terms of their learning, it would be great if they could be at school. But as I said before, I understand where you're coming from and the concerns that you have. And, you know, perhaps talk to your school about, is there ways that perhaps she could come in for part-time and get some learning from home, so that you're aware of when she's in and when she's at home, to just keep her protected a little bit more. I don't know if that's possible. Or even just have a conversation with them about making sure that they are informing you if there's any respiratory infections in the class, etc.
Okay, and do you allow trikes at school?
Yeah, so we have once a week, we have the children using trikes as a set activity, if you like, for an hour on a Friday afternoon. That's in finer days. So it tends to be the first autumn term and then the second spring term and then the both summer terms. And it's good because obviously it's part of their physio program. It's huge for their independence. Some of our children who aren't great power chair users or wheelchair users as well sometimes intersperse that with using their chairs as well, so that they'll go around a course, etc. So it's all about safety, their independence, their strength, their stamina. It's a key part of their development, I feel. But as a school with an SRP, it's not just one child, so we can do that. You know, we're doing it with more than one child. And I think it can be tricky with schools with just one child where that's happening.
Okay, next one is, do you have inclusive toys that represent disability?
Okay, that's a tricky question. I think we could be better at that, honestly. We try where possible to make sure that everyone is able to access the toys. It's a completely new ball game now anyway, because many toys have been deemed unsuitable to use due to COVID, due to cross-infection. So we are having to really think about the toys that are out there. and what is available and safe to be used. We are also trying really hard to get away from using a lot of plastic toys, although plastic is the great thing at the moment to be washed and kept clean and hygienic. So it's really strange. In education, you're trying to get away from plastic, and yet COVID is coming along and saying it's better to use plastic. So things, I'm thinking, you know, things like sand trays and water trays generally could be better. And I know that you can have sand trays and water trays that are accessible for wheelchair users, and that's certainly something that I'm looking into as a school. But in terms of other toys that are showing a range of disabilities, I don't believe we're doing enough, no. So thank you for raising that.
Okay. We have got something, someone's typing, I can see like the little
Oh dear.
wavy dot.
Have I upset somebody?
No, I think it's another question coming through. So I'm going to wait to see if that pops up. And then I think that will be all the questions. You've done an amazing talk. Thank you. Well, if that's to anyone. Oh, the dots have stopped. No, it could be my internet, you know.
If there are other questions that crop up as a result of this, I'm happy, you know, to be contacted by you guys, you know, and if I can answer any questions, I'd be happy to. I won't necessarily be contactable every day during the summer break because we have worked through all the holidays and the bank holidays since March. So I will be on my emails, but not necessarily every day. But I'm more than happy to answer any questions that come in if that's the case.
Okay. Yeah, I think my phone doesn't want to work right now. So what we'll say is thank you to Michelle. Been absolutely, the dots have started again. I don't know what that. Okay, yeah, we'll say thank you, Michelle. The talk has been fantastic. Like Michelle said, any questions that you think of, you can message the page and we will pass them on to Michelle and get back to you as soon as possible. But obviously, Michelle is on break from school at the moment, so we'll give her time to reply. We will also drop the link for the shielding charity. Can you remind us the name of that?
So it's on Facebook at Shield Us 2020.
Okay, we will drop that link on our pages once this live is finished. So thank you again, Michelle. It's been fantastic, and I hope you have a lovely weekend and summer break. For everyone else, our Awareness Month officially begins tomorrow. How exciting is that, and how quick has August come around? So make sure to look out for our posts tomorrow and on each day for the rest of the month. And yeah, that's great. So we'll see you later. Thanks, Michelle.
Thanks. Bye bye.